Good evening, and thank you for joining us. We're going to get started here in just a moment, and we thank you for joining us for this week's Community Leader Call. We'll get started here in just a second. Thank you. Good evening, and thank you for joining us for this week's Community Leader Call. My name is Tomas Talamonte, and I'm Deputy Chief of Staff to Mayor Muriel Bowser. We want to thank you for joining us this week, and we are here to answer your questions related to the district's response and recovery efforts for coronavirus. And so before we begin with our speakers, I want to remind everyone, if you have any questions for our directors, please press 0 and you'll be entered into the question queue. So we're going to try to focus majority of the time for the call today on answering your questions. So if you have a pressing question that you would like to ask to either our director for the Department of Health, Dr. LaQuandra Nesbitt, or to the Department of Homeland Security and Emergency Management, Dr. Christopher Rodriguez, you can press 0 now, and you'll be entered in our question queue. So again, want to remind everyone before we go to Dr. Nesbitt, who will open up with some opening remarks. For all of the most up-to-date information and resources, please visit coronavirus.dc.gov. We are currently in phase 1, so I want to remind everyone for any guidances or materials for businesses, restaurants, retailers related to phase 1, you can visit coronavirus.dc.gov/phase1, where all of our guidances are available. And just want to give a big thank you to Dr. Nesbitt's team and the full staff at DC Health, who have been working very, very hard on all the public health guidance related to our phase reopening. They're working every day to make sure that as we reopen, we're doing it safely and following the science on our phased approach to bringing reopening the district. So without further ado, I'm going to pass it to Dr. Nesbitt to open up our call.
Hi, thanks everyone, and thank you for joining us on the call today. This morning during our press conference, Mayor Bowser reported that we have 63 new confirmed cases of COVID-19, bringing our total positive cases to over 9,500. Sadly, we also announced that yesterday we had 4 Washingtonians succumb to the virus. As most of you know, we are now in phase 1 of reopening. We have been closely monitoring a number of metrics to give us a sense of how the virus is spreading now that we are in phase 1. In the coming days, we will be able to draw trends, but the earliest we will be able to begin phase 2 would be on June 19th. Today, we also launched our new dashboard on coronavirus.dc.gov, so we encourage you to view that dashboard daily to follow along with our progress for our phased reopening. As we continue to move toward each reopening phase, it's important for all residents to continue to, as you participate in phase 1 reopening activities, to continue to take preventive measures by wearing a mask or face covering that fits snug against the face and covers both your mouth and nose to reduce your exposure to the virus. Also avoiding close contact with people who are sick, washing your hands often with soap and water for at least 20 seconds, using an alcohol-based sanitizer if soap and water are not available. We want you to avoid touching your eyes, nose, and mouth with unwashed hands, covering your cough or sneeze with a tissue and then throwing that tissue in the trash, and to clean and disinfect frequently touched objects and surfaces. Obviously, in recent days, we've had more people out in the community than we expected to have during Phase 1. We're proud that so many people have been wearing masks at the protest, but we are encouraging people to take actions related to testing. If you need a test, you can get a test. If you are experiencing symptoms of COVID-19, you can call your healthcare provider or the testing hotline. If you are a close contact of a laboratory-confirmed COVID-19 positive individual, testing is recommended, and you should wait at least 3 to 5 days after exposure before seeking a test. If you participate in any Phase 1 activities or attended the First Amendment activities that have occurred in the district over the past week or so, and you want to be tested as a result of a concern about your exposure, you should wait at least 3 to 5 days after having participated in those activities before seeking a test. The district has a number of testing locations throughout the city, including our free walk-up testing sites at firehouses, which are open 5 days a week from 4 to 8 p.m., and we also have locations that will be available on the weekends. You can find more information for those testing locations at our coronavirus.dc.gov website under the testing tab. So we look forward to having a robust discussion with you all this afternoon, as always, and taking your questions and hearing your feedback.
Great. Thank you, Dr. Nesbitt. And again, Director Rodriguez is here as well to help with answering your questions. And so we're going to jump right into it. I want to remind everyone, press 0 now if you would like to be entered into our question queue. And I see a lot of similar questions related to fire station testing. So I'm going to go to Commissioner Hamilton in 6D. I see your question being asked by several people, so we'll go to you to get the answer. So Commissioner Hamilton, go ahead. Your line is unmuted.
Hello, everyone, and I just want to extend my appreciation to the Mayor Bowser and Director Nesbitt for all the amazing work and outstanding work that you're doing to protect the residents in the district. My question is for the free testing at the fire stations. I saw that will go on to June the 15th. I wonder if there is going to be, if that deadline is going to be extended to allow more residents to get tested. My second question is regarding ventilation systems in buildings and restaurants. I wanted to know what are the plans in place to kill the virus if it enters the ventilation systems to prevent it from being circulated.
Great. Thank you for that, Commissioner. Commissioner Hamilton. We'll go to Dr. Nesbitt.
Hi, Rhonda. It's so good to hear from you, as always. We have two things I'll respond to both of your questions. I want to make sure that everybody knows where we will be tonight for the firehouse testing. We're going to be at Engine 10, which is at 1342 Florida Avenue Northeast from 4 to 8, and Engine 30, located at 49th Street in Northeast from 4 to 8. We have initially advertised the firehouse testing for June 15th. So the locations that we have made available, we're announcing those locations as decided through June 15th. We're going to make a decision about the firehouse testing and reassess based on the turnout and the level of activity. You should know that we've had nearly 600 people tested since in the past couple of days alone at the firehouses, just the 4 locations that were used on Monday and Tuesday. And it's important for us to be able to do a reassessment of the locations that are more popular and where we have more residents going. I've had the opportunity over the past couple of days to go to all of the sites, to be able to talk to residents, to get a sense of where people are coming from who are using the firehouses, to learn which ones are most walkable, why people are using the firehouses, and we want to be able to have the opportunity to do that assessment to know if we should bring on more stations, relocate the stations in different parts of the ward to make them more accessible. As for your second question, In phase 1 of reopening, we have outdoor seating at our restaurants. Many of our restaurant owners actively participated in focus groups, responding to surveys, and then giving us additional insight in the Mayor's Reopen Advisory Group. That process gave us the ability to understand any structural changes, including the use of the ventilation systems inside restaurants that could help them prepare for subsequent phases of reopening. And that includes whether or not they could use the existing ventilation systems, needed to install any additional filters, or should have doors open to allow for the circulation of fresh air into the facility to reduce the transmission of the virus. So all of our restaurants have been given that level of information. We'll be hosting additional webinars and sessions with them to help them prepare for the phase 2 reopening, which will allow for indoor seating to resume in restaurants and food retail establishments in the district.
Thank you, Dr. Nesbitt. And I do want to remind everyone again where to see all of the testing locations available and their testing schedules. That is, again, at coronavirus.dc.gov/testing. That's all of our all testing sites that we are aware of that are posted there, so you can see not only the firehouse locations where you can do walk-up testing, but also our downtown location, our Anacostia location, and several other locations out the district to get testing. So again, that link is coronavirus.dc.gov/testing. We're going to go next to Diane in Ward 2. Diane, your line is unmuted.
Hello. I would like to know when the swimming pools are going to be open. I think the young people need some form of outlet, and I've read that swimming pools are relatively safe considering the chemicals in the pool, and it would help all of us with young children a lot to know when they would be able to enjoy the many beautiful D.C. public pools.
Diane, thank you so much for the question. And I will say that if I had to rank the topics and the items that had the most debate during the reopen discussion, communal pools would be definitely in the top 5, if not in the top 3. And as you have articulated, reviewing the CDC guidelines and recommendations for pools, the issue, the discussion point as to whether or not following the Model Aquatic Code and using the types of amounts of chlorine and disinfectants that are commonly used and found in pool water, there is suggestion that that would be adequate and sufficient to kill the virus. The concerns come in terms of the other things that happen at communal pools, in terms of the type of activities that tend to happen in communal pools with free play, the lack of lane swimming that happens in communal pools, and the other activities of sunbathing, shared locker rooms, and other free play in the pool area. Because of that, there is a recommendation that communal pools, both in the Department of Recreation facilities as well as those pools that we classify as semi-private and condominiums and apartment buildings, would not open until the public health situation in the district has continued to improve, where we are no longer in community spread. That would not occur into phase 3. So we continue to assess the situation. We continue to have discussions as to whether or not we can put some mitigating factors into play that would allow, as you have stated, families and young people to enjoy our lovely public pools that we all really enjoy, myself included. I look forward to the opening of pool season every year and enjoying my neighborhood pool as well. So we will continue to monitor the situation and continue to review it, and we'll work diligently to open our pools in the District of Columbia as soon as the public health situation allows.
Thank you, Dr. Nesbitt. I'm seeing several questions. Before we go to our next question, I have seen several questions in the question queue related to pandemic unemployment insurance and just a point of contact if you're having issues with that. Our Department of Employment Services has an email that you can send a message to if you're having any issues or have any questions related to PUA. That is PUA@dc.gov. Again, that email, if you're having any issues related to your pandemic unemployment insurance application, that is PUA@dc.gov. Next, we'll go to Ben Kieran. Ben, your line is unmuted.
Hi, good afternoon. Hi, Mayor Bowser. Thank you for your great leadership. Ben Kieran with Southwest Strong, a local preparedness group here in Southwest DC. Two quick questions. Contact tracing, just where we are with that, the hiring perhaps that I think may be still underway. And then also, to what extent we are building any kind of stockpile, if that's the right word, for our own community here in DC, DC at large, for any kind of second wave or, something even beyond that. Not knowing if we can rely on any national stockpiles, you know what I mean? Thank you.
Sure. So we have onboarded and trained and hired and are ready to go, or are actively working, actually, 200 contact tracers here at DC Health. We also have 100 district government employees who have been reassigned to DC Health for contact tracing work that will effectively bring the total number of individuals who are dedicated to contact tracing work to 300. In addition to that, we are building in addition to the 300 individuals who will be the core contact trace force, we have built and are working to build a contact trace force reserve corps that will be comprised of DC Health government employees who have taken the initial components of the training such that if the need arises for us to deploy more individuals to assist with contact tracing, this reserve corps will only require an additional minimum amount of training to be rapidly deployed. Separate and apart from that, as you all know, when we did our initial request for applicants, we had an overwhelming response from the community for people who wanted to participate in this work, and we still have individuals that we know we could recruit from who would be able to assist us if the need for us to flex up or down the number of contact tracers that we would need to be able to meet the metrics that we have for our public health goals. So that's where we are in terms of contact tracing. The mayor has been very committed to us having a local strategic stockpile that augments the strategic national stockpile that the district has also been accessing from the federal government. We have, and we will readily admit, we have been accessing the strategic national stockpile and getting resources such as masks, gowns, gloves, and surgical masks, gowns, gloves, and face shields from that strategic national stockpile. And we've also been receiving some of the items that we need for testing, such as swabs, transport media, and the like. That notwithstanding, we have done a tremendous job here in the District of Columbia purchasing the things that people need for personal protective equipment, such as the aforementioned items, the gloves, the face shields, the gowns, and also the sanitation products that we need for the government, but also some of our small businesses may need. Because of that, when we moved into the Phase 1 reopening, we were able to provide starter kits to small businesses throughout the community to allow them to safely reopen or have a safer reopening. So they were able to receive from us some starter personal protective equipment and some starter cleaning products. We were also one of the few, if not only, jurisdictions that provided our dental providers with personal protective equipment that would allow them to begin to offer a more expansive number of services beyond the emergency procedures that they were offering. So we believe we are well situated in the district. Can we have more? Yes. We're always looking to continue to purchase more face masks, both cloth and surgical, to have for our employees and to be able to rapidly respond to the needs of our business community and the general public.
Great. Thank you, Dr. Nesbitt. We'll go next to Andrea Stocks in Ward 7. Andrea, your line is unmuted.
Good evening, Dr. Nesbitt. You recently said that anybody who wants a test can get a test, but it looks like there's just one location, which is in Judiciary Square, that allows for people to get tested without a doctor's referral. And what I want to know is, with the free walk-up testing sites that'll be held at the fire stations, can you be tested as an asymptomatic person?
This is an excellent question. And if anyone who needs a test can get a test, we've been offering asymptomatic testing in the District of Columbia at our testing sites for quite some time. What we believe we should make clear in terms of a distinction is our testing sites that require an appointment versus those that have a walk-up option. And so our testing sites at UDC Bertie Bacchus, our testing sites at in Anacostia, are drive-through testing sites that require an appointment by calling our 1-855-363-0333 phone number. They have some limited walk-up options available. The F Street location is an exclusive walk-up option that is open 5 days a week from 10 to 2. So that's a major distinction between the F Street option and the UDC Bertie Bacchus campus and the United Medical Center campus. The criteria for testing is the same at all locations. Similarly, the Firehouse locations, which are open from 4 to 8 p.m., Monday through Friday, and there is a Saturday option that is available from 12 to 4. Those options are walk-up only as well. No advance appointment can be made. And so the appointment-only locations tend to queue people a little bit faster, and we know and we can anticipate how many people are going to be coming through the drive-through, whereas the walk-up locations, you queue with all of your lovely neighbors who are making decisions at the same time to come and be tested.
Thank you, Dr. Nesbitt. Before we go to our next question, I just want to remind everyone, again, if you have a question, please press 0 now. We just have time for a few more. We try to keep the calls to 30 minutes, but if you have any questions and you want to get in the queue real quick and your question has not been answered, press 0 now. So we'll go to our next question from Reverend Mercer Staton in Ward 4. Reverend, your line is unmuted.
Thank you. Dr. Nesbitt, thank you for all of your assistance. As I'm sitting here looking at the coronavirus update, the situational update, and it says that it would be updated on Wednesday, June 10th. And when I look at the number of increases beginning with Friday, June 5th, the numbers continue to go up. So can I assume that we're still in phase 1 with further consideration for phase 2?
Yes, ma'am. I'm looking at what you're looking at, so I want to make sure I'm being responsive to your question. What I would encourage you to do is to look at our dashboard, and on our coronavirus.dc.gov website, on the data section, we have the metrics that we're going to be using for decision-making for transitioning into phase 2. And there's very specific metrics that are listed there. We also have a clear line that says we need to be here, and it has a period of time that we need to be there, and then it has a very clear achieved, not achieved, that will help anyone be able to determine whether or not we've met that metric in order to be able to move into phase 2.
Thank you for that, Dr. Nesbitt. And again, we launched the dashboard today, the updated dashboard. So it's very easy to use, easy to navigate. very clear and concise for people to stay up to date on that. And so we want to remind you again that it's coronavirus.dc.gov under the data tab, and hope you will join us by looking at that. And we always appreciate, on these calls we've been given feedback on how to maybe present the information a little bit better, and so we always take that to heart and have been we hope that this update to the dashboard reflects a lot of the flags that we've heard from you all on the call. So we'll go to two more questions here. So our next question is for, let's see, one second. The next question is for Joyoti in Ward 3. I hope I'm not mispronouncing your name, but Joyoti, your line is unmuted.
Hello?
Yes, your line is unmuted.
Yeah. Can you hear me?
We can hear you.
Can you hear me?
Yep, we can hear you.
Yeah, okay. My question, actually, I had a two-part question. One was about the statistics regarding the incidences and the number of deaths. While the incidences seem to be going up, the number of deaths are going down. So are we anywhere near flattening of the curve? And the second question is, have there been an identification of the persistent hotspots, virus hotspots in DC? And has there been any thought given to containment zones for those hotspots?
Yeah, so thank you for your question. One of the things that we are looking at in terms of when we talk about flattening the curve, what that means is that we have reduced the number of individuals who are sick at any given time, or the daily incidence and the total number of active infections. So in terms of our success in flattening the curve, or whether or not we have flattened the curve or reduced the height of the peak, we would venture to say that the number of infections we were expecting to see has been reduced from what we were expecting to see. And that is a function of the public and how well the city did and the residents did in terms of adhering to the stay-at-home order and social distancing. What we are cautious to opine on at this point is the impact of the first phase of reopening. And so we need to be able to monitor the data and see what the impact of phased reopening and large gatherings of individuals in the first phase of reopening yields in terms of data. And so it is unknown to me and the data team here at DC Health whether or not that will result in a second peak, and if that second peak will be higher than the peak we saw the first time around. As you may know, the number of deaths that we see on a daily basis is a function of the severity of illness. And as we can reduce the risk to our most vulnerable populations, that reduces the likelihood that individuals in our community who are most at risk are having severe illness and that mortality can occur. So that's why it's critically important for individuals who live with people who are at higher risk of having severe illness, do a good job of practicing social distancing, do not go out and participate in activities that would put their household members at risk, and that we take particular care and concern for people who live in congregate settings such as long-term care facilities and assisted living. We do all we can to protect them. Lastly, on the issue of geographic hotspots, we have identified some areas of town where the what we call the test positivity is higher than we would like. So when we go into that community and we test people, the proportion of people who test positive is higher than the city's average. And so that concerns us greatly. When you mention things like containment zones, we are a porous city with porous borders. So it is very difficult out of what we call the 51 planning neighborhoods to suggest to someone who lives in Capitol Hill that they must remain in Capitol Hill and not go to Georgetown, because we often don't live and work in the same neighborhood in the District of Columbia. Things like creating containment zones are more effective strategies when implemented in large states and in countries.
Thank you, Dr. Nesbitt. We have time for one final question, and we're going to go to Maria Ann. Maria Ann, your line is unmuted.
Yes, this is Mary Ann Griffin in Ward 3. I'd like to understand why it is that Northern Virginia is able to safely open this Friday and D.C. not until the following week, given that our death rates and incident rate are similar to one another, and they're just literally across the river.
Well, different leadership makes different decisions. We are using a process, and we've outlined very clearly what our metrics are for making decisions to reopen in the District of Columbia. We decided very early on that we wanted to be committed to a certain number of days of a decline in community transmission in the District of Columbia. We do not yet see that amount of decline. We also wanted to be sure that we were measuring our testing capacity in a particular way, which meant that our test positivity rate, which as I described is how many people who are tested test positive. And we want that to be below 15%, and we wanted to measure below 15% over a 7-day window. That has not yet been achieved in the District of Columbia. We want to make sure that we have the public health system capacity to rapidly respond and to outbreaks, to do case identification of everybody who is positive, to identify all of their contacts, and to isolate and quarantine anyone who is positive in all of their contacts. We have not yet been able to achieve that for 90% of our positive cases and for 90% of their close contacts. The good public health evidence and science suggests that that needs to occur. You may find that the counties in Northern Virginia are not using the same set of public health metrics for their decisions to reopen. They may be using other things like measuring hospital capacity, which we also look at, or measuring just the trends in deaths. So if they are using a different set of criteria and making decisions on that criteria, that may move them forward. But we have made a commitment to looking at a robust set of criteria for determining when it's appropriate for us to move forward by understanding community spread, which indicates how much virus is present in our community, for looking at our hospital capacity. So if our rates go up, we know that people can be cared for safely, and our hospitals and our healthcare system can respond without operating in crisis mode, that we have the ability to test. So if you need a test, you can get a test, and that the rates of people who are testing positive is low for what's recommended in this phase of reopening, and that lastly, we have the public health system capacity to rapidly respond and to outbreaks and to isolate and quarantine everyone who tests positive. So that is how we are making our decisions for reopening, which may be different from other jurisdictions, even if they are our neighbors.
Thank you, Dr. Nesbitt. And I really want to reemphasize that, the mayor and leadership that have been responsible for the response and recovery efforts on coronavirus.gov have been in constant communication with regional leaders and our regional partners throughout the length of the pandemic. But as the mayor stated from the beginning, we are going to follow our health experts, our public health experts, on how we safely proceed through the response and reopen in the district. And so I just want to thank our public health expert, Dr. Nesbitt, and her team for all of the work that they've done to help us safely open with Phase 1, and when the data is right, when we start with Phase 2. So before we close out, there was a few questions related to the timeline of how long PUA will be effective. PUA is effective through December 31st, 2020. So that is, it does not end in July. It is effective through December 31st, 2020. And we do have a very handy step-by-step quick guide for all things unemployment available on the coronavirus site. That is coronavirus.dc.gov under the recovery tab for individuals. There's a quick guide for anybody that needs help with going through PUA and making sure that you have any of those questions that you have or need to get some information on, that you can go there. And then to close out, just want to remind everyone, again, just made a plug for the website, but once more, all of our information related to Phase 1, all of our guidances and recommendations are available on the website, and we hope that you will go to the website and visit it. Also making a plug for the census. If you've not completed your census, we hope that you do so. We want to get our response rate up in the district, so again, going to census.gov, and we hope that you will complete your census and make sure that you are counted. And I want to thank Dr. Nesbitt and Director Rodriguez for being with me on today's Community Leader Call. We hope that you will join us next week for our call. If we weren't able to get to your questions, we definitely will next week. And want to remind everyone, one last plug, we are in the midst of budget season, and so we hope that you're engaging online virtually with the different council hearings on the mayor's proposed budget, but we hope you're engaging with your ANCs as well. And so we had announced to you all a few weeks back about the coronavirus.dc.gov/ANC portal, where we have all of the ANC meetings listed online, nice and quick and handy for you, so you can join your ANC and stay informed and stay engaged. We've updated that list for June and July, so we hope that you will go and visit and join an ANC meeting, be engaged with your community as we go through the budget, as we go through